Nina Turner has been on a rampage, and the rules of her rampage is that she says as many dumb things as possible inside of one day, and she's doing a great job.
Mm-hmm.
All right, so I want to commend her on that. She put out this chart from Our World in Data that says life expectancy versus health expenditure. And if you're not watching the video, you'll see on the chart that you got a whole bunch of countries that pay less per person, per capita, and have a higher life expectancy. And then you have the U.S. at the bottom of this, which pays more per person and has a lower life expectancy, albeit the life expectancy difference is by a few years, but still, that can matter. And Nina says this is what privatized healthcare has gotten us. Charlie, would you describe our healthcare system as a privatized healthcare system?
No.
Now, there are private companies who reap the profits of the system that we have. But are those private companies making all of the decisions?
No, it's completely government regulated.
No, it's really close to like a fascist healthcare system where you get the private ownership of the company, but the government controls
all of the rules.
Everything that you do is based on government rules. There's like not a thing that you can do that there's not a whole book of rules on that people have to go through. And so calling it the privatized healthcare industry was annoying to me. So I brought up the other thing. You can't just say that it's because of the healthcare system. You'd also have to look at a very, very big factor between the USA and, say, Norway and Japan and South Korea and Denmark and Germany and the UK and Switzerland and all the other countries that are on here. The really big thing you'd have to look at would be the obesity rates. America is a very fat country per capita. Our weight per capita is much higher than those other countries, which is going to take years off of your life. All right, you can't just blame that. Even if you were going to say we had a totally privatized healthcare system, you can't just blame it on that. You got to look at the health culture of the country, and we are a much fatter nation per capita.
There's an obesity problem in America.
There is.
That's for sure.
And that's because we have a free market in food for the most part. So, we got way more food than we need. So I pointed out some stats on this just so we know. The chart that Nina posted goes from 1970 up to 2018, which would be like some of the most recent data that they had for that chart. And during that time, the third-party payment as a percentage of our total national health expenditures, the money that was spent on healthcare, third-party payment, meaning you didn't pay it yourself, grew from 68% to 90% of the healthcare expenditures. The public health expenditures as a percentage grew from 22% to 42.5% over that time. It almost doubled as a portion of how much money was being spent on things. Out of pocket and private insurance used to be 53.1%, and now it's 38%. Okay, another good stat is that out of pocket used to be 32.7% in 1970, and now it's 10.2%. And that's in 2021. And so is that a healthcare industry being privatized at that moment? Or is that actually the public health side of that equation
increasing? Basically
doubled during that time. And then you also have an increase in the amount of that health insurance was paying. So more people having health insurance, more people get health insurance from their jobs than they were getting in 1970 as well. So a lot more people are using health insurance for more and more things. And also health insurance is mandated to cover more and more things. And so it's picking up a bigger portion of the pie. And as you have multi-billion-dollar industries, or you have multi-trillion-dollar government paying for things, the expense that is allowable that people will charge and that will get paid for those expenditures continues to go up and up and up, as opposed to if it were just me or Charlie going to pay for something, they would actually be restricted by a free market payment system. in that time. So that's one little portion of about a 1,000 different things that we could point out for why healthcare is so expensive.
Healthcare is too expensive.
It is.
It has nothing to do with the fact that it's private.
No.
Because it's not.
No. So it can't.
So it can't
It's impossible for that to be the problem.
Yeah.
And I wanted to mention Nina also, she was on a roll the other day. She said either we have single payer healthcare or private companies will profit off illness. There isn't a middle ground.
Can't argue with that.
Either we have single payer healthcare or private companies are going to profit.
She's like, it's one of two options. No, that's it.
Those are the only two things. And so what she's insinuating there is that in a single payer healthcare system, private companies are not going to profit from things. But a single payer healthcare system, all it says is that the government's going to be the payer for all the things and the private companies are still going to do it. But she's saying that they're not going to profit off of people.
Well, they may only profit like 10%. You know, they'll move those margins down, Nate.
Look at that. You know, like the same brain. So I said profit will be outlawed under single payer. And this person said, no, you can make a little above your production cost. But to fight for these companies making millions, if not billions, off sick and dying Americans is disgraceful. So this person says that we should use cost plus.
Mm-hmm. And guess what's going to happen?
That's their idea.
The cost is going to go way up.
The cost goes up. And in fact, Charlie, I thought it was a great time.
Just like when you're a server, okay? Like, look,
True.
Your job as a server is to increase the ticket price. And that's because most people will pay your tip as a percentage of the total bill. And so the higher you can get that bill by selling desserts and appetizers and drinks, the higher you can get it, you're the more likely chance you are to have a higher tip. So you increase the cost of production so that your percentage, your plus amount, increases.
That's a great analogy.
Yeah,
I don't know if we've ever used that one before, but that's really good. I like that. I thought we should have Spike Cohen talking about this because Spike already talked to us about cost plus, and this would be great for the radio as well.
All right.
So cost plus is the idea that the problem with the cost of healthcare is that there's too much profit in it, right? And so if you just tell the hospitals and the healthcare providers, well, you can only charge 1% more than you're paying for the product or service, then that'll make it cheaper because they can't profit as much, right? There's no way that they could game that. There's no way that I, as a doctor who is trying to figure out how to make sure I'm getting everyone paid and still put money in my pocket and pay off my student loans and everything else, there's no way that I figure that instead of buying this saline bag, IV bag for $1 and being able to make 10 cents off of it, that instead I could buy this saline bag for $300 and make $30 profit off of it and know that I can charge that much because I'm not charging the patient directly most of the time. I'm charging a multi-billion-dollar insurance pool that's required by law to pay it. There's no way I would do that, right? There's no way that would happen.
When you say it that way, it sounds perfectly rational.
This cost plus is probably, I would say, possibly the single biggest contributor to the spiraling out of control cost of especially hospital services. It is a direct result of all of the providers going, oh yeah, we don't want you to make too much profit on our $700, IV catheter or whatever. Like, I mean, the things they're charging are as a direct, it's like what government is under cost plus. Government, they're contractors, they can only charge a certain percent more than they cost. And that's how you end up with a $23,000 hammer. So they took that amazing economic policy and moved it to the healthcare sector. And wonder of wonder, now hospital services cost a fortune.
All right. That's right.
Now, it does work. I will say it will work in the private market, like what Mark Cuban is doing with costplusdrugs.com, because his whole goal is to actually save consumers money.
Yeah.
So he's trying to find the cheapest actual cost of these medications and then only add the 15% profit on top of it, which is saving people thousands of dollars. But once it gets to the point where it's no longer saving anybody money, no one's going to use it.
Yeah.
But he's having to compete in a free market way against other companies that don't, but like Spike said, because they can charge this multi-billion-dollar pool of insurance that people are forced to pay into, and therefore can continue to suckle
the teat
of the plus.
Yeah, Jeff, that's the interview where we had a Spike and Nate's Chicken Shack or whatever it was that we came up. That's in the that's towards the end of this.
It'll be a cost plus chicken shack. Yeah.
Well, we were talking about CON laws at that time, and anyway, it's a great interview. I'll put the link to this video in the show notes for everyone. Charlie, we gotta go.
It's time.
The government, they're here
to
help.